Radio City presents
Dementia is an umbrella term used to describe conditions which majorly affect the memory, new learning capabilities, ability to plan and execute day-to-day tasks, language, ability to make decisions as well. The above-mentioned impairment in the cognitive function is also accompanied by changes in their mood, behavior, emotions. As dementia is progressive, somebody diagnosed with dementia will eventually become more and more dependent towards their loved ones. Currently, around 55 million people worldwide live with dementia. There are around 10 million new cases every year. Age is the strongest known risk factor for dementia, but dementia is not an inevitable consequence of aging. For some people, genes pose as a risk factor for developing dementia. Some medical conditions, for example, high blood pressure, being diabetic, injuries to brain, etc., can make them vulnerable to develop dementia. There are few lifestyle risk factors as well. Having a poor diet, having no physical activity, substance abuse, and not being physically and mental activity also makes you more vulnerable to develop dementia. Well-trained and passionate team at Maarga are involved in the care of people with dementia, making their lives better. Also support for carers. To begin with, when the patient comes in with memory difficulties, the patient undergoes physical examination, testing in the form of cognitive tests, undergoes a dementia panel in the form of blood test, and also brain imaging if required. Once the patient is assessed with regard to the severity and impact of dementia on their lives, the treatment involves two components. One would be the medications. To tell you about the medications, I should mention that there is no cure for dementia. The anti-dementia medications that are available may stabilize the illness or may slow the progress of the illness. The second aspect of treatment would involve the non-pharmacological or not medical treatment that is available. There are a group of psychologists, psychiatric nurses, occupational therapists, and social workers involved in the care of patients with dementia. There are a lot of therapies that are available that would help the patient with dementia, which include activity scheduling, activities involving cognitive stimulation, aromatherapy, music therapy, multisensory stimulation, and environmental modification. The treatment also involves providing information and long-term support for carers of dementia patients.
Radio City presents Ask Maarga.